Thank you, Premier. So there were 18 locally acquired cases of COVID to the 24 hours to 8 p.m. last night. 15 of the new cases are linked to the Bondi cluster, and we've had 3 cases that have acquired overseas. There are currently the key highlights for today in terms of the key messages that I would like to get across firstly are that we are asking people, we do want to at this time protect our elderly. So it's important that we don't have visitors to hospitals and visitors to aged care facilities. Those steps were taken very early on. We routinely engage with the aged care sector and provide advice, but I do want understanding at this time. There are obviously exceptions to those where there may be end-of-life care or critical moments that it is important that you visit, but we would ask you at this time to minimise your attendance at those and only do so for those very special and extreme circumstances. I'd also like to say that older people are prioritised in the queues for testing. We have seen a few cases of elderly people that have been infectious in the community, and it's led us to wonder whether they're concerned about waiting in queues or the time it may take. I just want to reassure those elderly members or the frail members in the community, as well as pregnant women, that should you present, we're asking all our services to have a sort of prioritised queue or a way of bringing you to the front of it so that you don't have to wait. We would ask you to reach out to your general practitioner by the phone, and he or she could give you advice about what's the best testing option for you. But we do really want to make sure that we are testing everyone, and particularly those people with symptoms in Dover Heights, Vaucluse and Bellevue Hill. Just to reassure you, there's many testing sites in those areas, and please come out for testing. I think it's also important that we note that getting vaccination is a key thing. We're also seeing some of our elderly cases not vaccinated, and just want to remind the community that whilst initially there were really constrained supplies of our AstraZeneca vaccine, the Commonwealth has rolled out that vaccine progressively through general practice, and we also have access through health clinics, and I would urge everyone to take this opportunity. Now, if you are going to get a vaccine, a couple of safety tips. Please do not go if you have any symptoms, and please, before you set out, please check the exposure venues to make sure you don't feel you aren't a close or casual contact, and follow that public health advice. Please wear a mask, but please go out and get vaccinated, and we urge you to do so. There's also been quite a lot of confusion between the stay-at-home requirements and the self-isolation requirements. And our close contact and tracing teams had a number of people calling up. So just for clarity, if you are a close contact, you are required to isolate. And isolate means that you do not come into contact with anyone else in your house. It means that where possible, you've got a separate bathroom, you wear a mask if you're transiting through any shared areas. In effect, you are in a cocooned environment away from others. It is critical that you do so. The stay-at-home measures mean that you are only permitted to leave for the 4 essential reasons or with a reasonable excuse. And as we've indicated, the order specifies examples of those, but we really are asking for common sense. At this time, we do not want people spending large amounts of time in retail environments, other environments. We want you to minimise your contact with others. I know for many people that are subject to the stay-at-home requirements, that it is a time where they would appreciate phone calls from friends and relatives and keeping engaged with them. Now, if people are also providing care and support to those individuals and, for instance, dropping off meals, if that could be done in a contactless way. But if you do need to support your aged and frail relative and you do need to visit, please wear a mask, even indoors, and try and visit at the more warmer parts of the day, and if it is a sunny winter's day, sit out and use well-ventilated spaces. Again, but do not visit anyone if you have any symptoms at all. In terms of some of the cases that we just wanted to mention, is there were 2 additional South Coogee Public School students that tested positive for COVID, bringing the total number of students with COVID at the South Coogee Public School to 4. And because of those additional cases, and because there's also a number of interactions between the school groups in the different year groups, all students are now close contacts and must get tested and self-isolate for 14 days regardless of a negative test. There was also a child at the Emmanuel School that was present whilst infectious, and information is going out to that school community defining who is a close and casual contact. That communication is going out through the school, consistent with the advice of the Public Health Unit. It is important, we've also had some questions in relation to when a child becomes COVID positive and what steps you need to take. And basically there is a plan developed, and a bit depends on the age and independence of the child, but it's very much a tailored one. The considerations are, if you were all exposed at the same time, what works for you as a family, what are the health conditions of the people that may be in that household, what is your ability to self-isolate, and obviously the age and independence of the child. So all of those factors go into how we do a self-isolation plan. So my key messages: get vaccinated, support your loved ones, encourage testing, and please follow the health guidelines. And please, this is not a time to think, oh, the health guideline says this means I can do something a little bit outside the box, or this is a time for us to pull together and comply. We are going to see the numbers bounce around. So I am pleased to be announcing 18 today, but they will bounce around. As I'd indicated, what's going to be key is the number. We would like to increasingly see all our cases are occurring in isolation. All the cases are linked, and we will need at least another 5 days to see this picture turn around. The restrictions came in towards the end of last week. There were some other mitigations earlier on, but the cases we have now reflect exposures that occurred 5 days ago. And therefore, it is important the community understands that the numbers are not expected to decline for another 5 days. But if we don't want to see these cases dribble on, we all have a role to play in adhering to the health advice. So if you are a close contact, don't think I'm vaccinated or I was really only there for a few minutes. Please follow the health advice, stay in there for the 14 days, get the tests and follow the health advice. That will give us the greatest chance to achieve no community transmission as quickly as we can.